Hi, I'm Adam Gray. I serve as the Director of EHR within our healthcare practice. I'm a nurse of 15 years with clinical, informatics, and leadership experience in the perioperative and procedural settings. In my role, I'm able to fulfill my mission to ensure patient quality and safety by working directly with EHR, ERP, and clinical teams. Today, I will be reviewing the Clinically Integrated Supply Outcomes Model by HIMSS Analytics. According to a survey of physicians, clinicians, and supply chain admins, 75% say seamless supply chain operation is critically important to supporting quality care and patient satisfaction. Yet still, 24% reported using recalled or expired product on a patient. 57% reported not having the product they needed during a procedure, and 18% reported a patient was harmed by not having the right supplies at the right time. These were contributing factors to 83,000 deaths over a 10-year period from 2008 to 2017. Hospital supply chain means real money, and it's a big problem. Supply expenses make up 15% of total hospital expenses on average, but as high as 30 or 40% in hospitals with high case mix index. Throughout the recent pandemic, hospitals across the U.S. have spent more than $3 billion to source personal protective equipment. Hospitals waste more than $5 billion annually in supplies. This is an infographic that captures the integrated healthcare experience. We're seeing the synergy and synchronizations between ERP and EHR, creating hundreds of related data points within each of the different platforms. Notice the key integration intersections during patient contact, from scheduling, which includes staff data and access management, to patient care, to claims and billing, to follow-ups. When we think about the integrated supply chain within the patient ERP and EHR experience, we can see supply chain integrates in almost every contact point. Product inventory levels are tracked automatically to minimize inventory cost. Data analytics enable inventory forecasting based on demand to reduce just-in-time cost. Integrated clinical programs using established quality measures informed by supply chain data to provide patient prep and education. Product usage, forecasting, and patient volumes inform planning decisions. Product use and care procedures is automatically uploaded to the patient's health records with standardized product attributes. Adverse event reporting includes products used, and case cost and physician benchmarks are reported to OR teams in real time. Medical errors and adverse events are tracked in real time, linked to the patient outcomes, and reported to inform performance management decisions. Product attributes are linked to patient outcomes by joining ERP data to patient care data. Patients access their personal health data with analytical tools to build health literacy and inform decisions to support self-management. And senior leadership can identify best outcomes for population segments and conditions under which best outcomes were achieved. In an integrated data set of both ERP, supply chain data, and EHR, patient data, related data can be combined, used to produce meaningful predictive analytics. Procurement best practice informed by real-world evidence emerging from supply chain data identifies and provides solutions needed for products that work best for patients. Procurement prioritization informed by real-world solutions and innovation priorities for specific patient to enable procurement teams to procure priority products that offer best outcomes for patients. In today's agenda, we'll review Avaap and HIMSS Analytics partnership. What is CISOM? Why is it important? How does it work? The first steps and key takeaways. HIMSS Analytics has created 7 maturity models. A couple of examples you may be familiar with are MRAM, which is the electronic medical record adoption model. It measures electronic medical record capabilities and the impact of the system and patients, as well as the analytics maturity adoption model, which determines how to leverage data for better care and process optimizations. Both, as you know, are aspiring and drive the market. They provide a roadmap and an opportunity to learn from other experiences by setting global benchmarking. Our partnership with HIMSS includes MRAM, ORAM, which is the outpatient electronic medical record adoption model, and then CISOM. We were the first firm to be certified to provide the assessment of their newest maturity model, CISOM. Therefore, it allowed us to provide some initial feedback to HIMSS. And what you'll notice here is Avaap integrates well within CISOM. We provide strong industry experience with ERP, EHR, and BI analytical services. CISOM is a framework, 8 stages for evaluating the capabilities of your supply chain infrastructure to support and inform stakeholders on improving patient outcomes and reducing healthcare costs through the use of digital health tools. CISOM is evidence-based and globally relevant. It's modeled and designed based off of robust evidence and pilot tested across 5 global jurisdictions. CISOMs is outcomes focused. It tracks every patient, the care received, products used in care, mapped to individual patient outcomes to measure quality, safety, and value. CISOM is prescriptive and aspirational. Each stage guides maturity and design with detailed indicators at each stage. It's aspiring because it enables population health outcomes and engages consumers as partners in managing their personal health and wellness. The chart to the right details each stage of CISOM capabilities. CISOM, the clinically integrated supply outcomes model. Stages 0 through 2, in summary, provide the global adoption of standards to enable traceability. It also introduces and implements the inventory automation that generates cost savings from reduction in waste. Stages 3 through 6 includes the adoption of analytics which predict quality and safety outcomes, which in turn produces product traceability, reduction in medical area, and reduction in variation in care. Stages 7 includes the personalized care delivery at individual patient level, the population health predictive analytics to support health and wellness. CISOM is broken down into 4 key areas. The 4 key areas represent balance across the basic and critical areas needed to broadly advance the effective use of clinically integrated supply chain, from connecting ERP technology to EMR through using predictive analytics to drive best practices in procurement and proactive risk management. It's personalized to population segments. As I review each of these areas, it's not uncommon for some areas of an organization to demonstrate high clinically integrated supply chain capabilities. Each healthcare organization is unique and it integrates supply chain capability in specific areas of the needs of that organization. Process automation. Automation of data capture for products, care processes, clinician teams, procurement, traceability of products and supplies. An example of this is product orders are generated automatically based on established min-max inventory levels, sent directly to the manufacturers using integration to ensure products are always available when and where they are needed. Inventory tracking is led by supply chain teams working closely with the clinical programs to ensure safe products are procured. There's no stockouts occurring and product waste is minimized. Clinical integration. Clinical integration of supply chain expertise in the clinical programs. Automated data capture at point of care. Accurate case costing of the level of individual patients informs clinical leadership decisions to standardize care routines. This reduces variation, which optimizes patient outcomes and ensures the best possible outcomes for patients at the lowest cost. Predictive data analytics. Data captured at point of care, uploaded, and translated into knowledge of forecast purchasing, productivity to identify value, safety at point of care. Two examples of predictive data analytics. One is trending analytics of adverse events provide teams with transparency. These events and the conditions under which the events most likely occurred enables health systems to advance and accelerate patient safety and quality outcomes. Another example is digital tools for patients to not only access their health data, but also analyze and understand the meaning of the data in order to inform their personal health decisions. And lastly, governments and leadership. C-suite leaders view supply chain infrastructure as a strategic asset for the organization. They mobilize teams to advance supply chain strategy. An example of this is leadership roles such as the CMO or the CNO that lead quality and safety initiatives, analyze the supply chain data, which enables segmented patient population based on patient outcomes. This can enable senior leaders to identify patient populations at risk, which informs them of the opportunities to proactively intervene to prevent illnesses. The four key areas essentially break down into three technology enablement pillars. There are 150 questions on the CISOM survey to achieve a given stage of an organization. A score of 70% or better for each stage, and all previous stages will determine the organization's stage. This allows flexibility in the model to accommodate different types of organizations, cultures, and approaches to maturity. Avaap is a cross-platform, industry-focused technology management consulting organization. We offer a broad portfolio of services in ERP, EHR, and BI, and analytics to accelerate business goals and deploy technology solutions and integrate current systems for business efficiencies. Avaap has been awarded over 100 corporate awards, worked with over 200 customers, with over 275 consultants and business professionals, with an average of 12 years of experience. Avaap's class recognized offerings include ERP and EHR services. Our consultants boast full life cycle expertise from system selection through post-production support, including data analytics and strategic approach to change management and workday services. CISOM evaluation process. Avaap educates and gets buy-in from the providers to engage in CISOM. Avaap requests and delivers, and then assess the hospital in completion of the survey. Upon completion, a baseline score is provided to both the hospital and Avaap. Next, HIMSS will calculate the healthcare hospital's gap assessment report and sends a copy to Avaap. Avaap then works with the hospital to build the strategic roadmap. CISOM's value and high-level approach. CISOM's value can consist of cost savings, patient safety, and analytics. The value for a patient organization includes reduction of waste and supplies due to expiration dates exceeded. Value for patients include the patient safety and personalization component. Transparency of value, what works best for patients and under what conditions. And then value for clinicians, provider teams, and overall industry can be summarized in the analytics portion. Accurate data captured to measure value of outcomes achieved at individual patient level and cost of care delivery across the journey of care. The key activities that Avaap provides with the CISOM evaluation is, as mentioned before, we start with on-site education. We establish vision, conduct strategy sessions, Examine the key strengths of the organization and identify the right stakeholders. We engage in the key stakeholders of the value of CISOM. And then we assess the current state meetings with each of the different stakeholder service lines. As mentioned before, we will work with each of the stakeholders to complete the assessment of CISOM. CISOM will deliver two deliverables. One is the baseline score and the gap assessment. The gap assessment, an example of that is here in the right-hand corner. Avaap will provide a second deliverable to align their gap assessment and provide recommendations. We will consider the available technologies, digital tools to advance the maturity and provide a personalized roadmap towards stage 7 maturity. This strategic roadmap will support and inform available and future technologies. An example of this was with our client in Louisiana. Avaap was providing Workday implementation services. We used CISOM as a baseline assessment, and then we incorporated CISOM criteria into the implementation objectives. At the completion of their Workday implementation, we will reevaluate their CISOM score, and we expect an increase of 3 or 4 stages. Let us help you with the first steps. We will engage with stakeholders. We'll get input from the stakeholders across the different platforms. We will help align and develop shared governance and vision, identify the needs and prioritize objectives and create accountability. Then we'll request a HIMSS survey and facilitate the survey completion to assess the current state of your digital health platforms and system integrations. If you remember nothing else, CISOM aspires to improve care quality or patient safety. It positively impacts patient outcomes and enables personalized tracking of implants. Clinical satisfaction. It improves clinical happiness of the EHR and uses prescriptive analytics to inform care delivery. Clinician-led decisions leading to reduction of unwanted variation. Revenue linkage. It increases supply and implant revenue in both the perioperative and acute care settings. Transparency of value, what works best for patients under what conditions. And cost savings. It streamlines inventory management, reduction of waste, and process efficiencies.
Adam, fantastic job. Thank you so much for the insights there and
Thank
the
you.
perspective from your experiences with all things CISOM. I've got a couple questions for you, sir, if you don't mind. What particularly is the average stage for an organization that has completed the HIMSS maturity model? Where do you see that average stage based off of your experience?
Yeah, so what the recent reports that we received from HIMSS, it's that there are currently around 100 organizations that have participated in the CISOM survey. All but one has sort of stage 0 in their path, in their initial assessment. One organization has scored stage 4.
Gotcha. Very cool. And then I guess what's the first thing an organization can do to start moving in the right direction when it comes to CSOM and the entire model?
Yeah, I think my experience and most recently we worked with an organization. It was the initial step is identification of current workflows and processes. Um, starting with your life of the supply processes, data flow mapping, who's all involved with the supply, how does it interact with the different departments. Once you realize and document those key stakeholders, you begin to realize how much clinically integrated supply chain is needed in your organization. That could be your initial first steps, integrating your clinical supply chain
Yep.
model.
And then I guess where I'm interested also in, because the model is mature, the evolution into the model probably is a journey. Where are some points of guidance that you could help frame up in the context of maybe quick wins as an organization is looking to ramp up into the model? What are some of those kind of quick wins that can help not only add value, but again, carry momentum forward so they can continue their maturity and growth?
Yeah, absolutely. Um, you know, leveraging um, your HR, there is um, quick wins in regards of supply identification, and that includes barcode scanning. So simply relying on um, external sources or internal sources to um, capture the barcode information. The G10 is a global identified number. This information can be used to barcode into your EHR system, which will improve compliance of using those supplies, and also documenting the use of those supplies. So the barcode scanning, I would say, is your quick win for that.
Yep. That's fantastic. Adam, great. Can't thank you enough for joining us here today. Thank you again for sharing all of your perspectives and experiences in this topic, in this domain. Much appreciated, sir. Hope you have a great day.
Thank you, sir. Appreciate you.